Why did you choose the field of reproductive medicine?
Well, initially, I went into medicine because I wanted to be a pediatrician, and then my interest changed to delivering babies as I experienced that, and ultimately helping people have babies. So working with those patients who struggle with infertility, I found very rewarding, and the science behind it is very fascinating.
What do you love most about your job?
Getting pictures of babies that I've helped create is immensely rewarding. So when I send patients out, I always ask them to please send me a picture, and so I get emails every week with pictures of babies, and then I continue to get these for years as the children get older, which is just a tremendously rewarding feedback for what we do.
How do you ensure you have a positive and successful doctor-patient relationship?
The most important factor is listening to the patient and understanding where they're coming from, so that you can work with plans, you can communicate and educate effectively, so that as you move forward, things are going to work well, and that you're available to your patients when they need you.
What would patients who have worked with you in the past say is your best attribute?
I think patients feel that I'm very sensitive to where they're coming from, that they can count on me to be there when they need me. What's actually very gratifying is not just the patients that are successful, but patients who have not been successful, who have said, I never could have come this far without your help, or that now that we've gone through this process, now I can move on to either using a donor egg or adoption, because I understand where I'm at and I understand where we're going, and it makes sense to me.
Describe a moment as a doctor that you're especially proud of.
I think of a patient that I had who had a very rare form of ectopic pregnancy. She ultimately had her uterus rupture. She was in the intensive care unit and could have died, and she was told that she never could have a child after this. I worked with her, we did some additional diagnostic testing, and ultimately came up with a plan where we put a single embryo back in her, and she has a child today, and I hear from her every year.
Outside of work, what's one of your passions or interests?
Well, in college, I actually started out as an astrophysics major, and then ultimately had a degree in film and literature, and did research in both those areas. After college, I traveled and lived overseas for several years before going back and pursuing pre-medical and medical studies. Now I don't have a whole lot of time to pursue those. I've got 2 little boys that play hockey, so I'm running back and forth to the hockey rink all the time.